Welcome to Design to Move, a weekly functional movement series reviewing common movement impairment syndromes, muscle imbalances, and injury cycles and how to correct for them. Don't just exercise, but restore optimal movement. Hey everybody, and welcome back to another episode of Design to Move. My name is Ryan Maxwell. This is Ryan Parr. We're both movement specialists here with Fluid Health and Fitness. Today we're going to go over a common condition called cervicogenic headaches. This has to do with additional pressure from your skull being exerted on the nerve endings on the backside of our neck, which then can create referred pain in and around our temples, our eyes, and be mistaken for a pressure headache or a migraine. We're going to show you how to do a few releases or stretches along with some strengthening exercises to align our spine to help to neutralize that pressure, reduce the pain and discomfort that you may experience because of this condition. If you have questions on any of the information we're going over, we are writing a blog on the topic. It's listed in the description below. Make sure to read that. Or if you want to reach out to us directly, you can get in touch with us at admin@fluidhealthandfitness.com, and we'll get back with you within a couple days. On that, let's get right into our program and get started with our releases. This is a soft tissue mobilization drill using an active release technique using self-palpation, your fingertips, and this is going to be a release of the scalene muscles and the suboccipital muscles. Our first release is the scalene muscle. This is a neck flexor muscle. It's often overused as it's an accessory respiratory muscle. And today we're going to show you how to get the diaphragm and the rib cage into a neutral position so that we don't have to rely on it as much. It attaches the transverse processes of the cervical spine to the first and second rib. And there's 3 sets of these muscles, or 3 groupings of these muscles. We're going to show you how to release all of them today. So using your fingertips, the middle finger and the index finger, Ryan's going to split his stance by stepping forward on his left. So we're going to target the left side as the example. He's going to use his right hand, find his sternocleidomastoid, the bigger ropey muscle that attaches the base of the skull to the clavicle, and go just lateral to it. There's a little pocket in there. And if you go medial to lateral with your fingertips, you'll feel some tight, stringy-like muscles. If you tip your head to the side, in this case he's going to tip right, he's going to feel those muscles start to stretch, get tighter or stiffer. And then you know you're on the right track. Now, if you feel a pulse, that's probably going to be your artery. You're going to want to skip past that. Again, move your fingertips. And he's going to breathe out, tuck his head to the side, tilt his head down, looking down, and then move his eyes to the bottom left, breathing out and retracting the shoulder around. When you do that, you'll feel a nice tug where the muscle attaches at the rib, and then maybe up into the neck. Make sure that there's no tingling or pain or additional pressure. This should be passive, soft, and not even uncomfortable. Just a nice elongation of that muscle. As you reduce it, come back up, go back to neutral, push in a little bit deeper, and see if you can go down further each time. That's how you're going to target the posterior scalene. If you want to get into the anterior, instead of tucking the chin down, you're going to rotate it up to the opposite direction. So Ryan's going to tip his head to the side, breathe out, rotate the head up, and again, you'll feel the pressure gradient shift to the front side, and you'll see more of the anterior scalene start to stretch, and it'll get a little tighter. So you'd go through about 6 to 10 of the breathing cycles, breathing out slowly, going through the motions that we just targeted, and then come back. Hopefully the muscle will become passive and softer, right? And you'll be able to get deeper and deeper and longer into those muscles. Once we're done with that, we're going to switch gears to the suboccipitals. This is an extensor of the neck and also a rotator of the skull anteriorly, posteriorly. So oftentimes it becomes compressed and tight because of the imbalance of the pelvis and the positioning of the spine. So the head, in an attempt to maintain its center of mass, will kick up and condense these muscles. So we want to reduce them, get the head back into a neutral alignment. And we're going to do that by changing our position. So Ryan's going to go from his left foot leading to his right foot leading. He's going to go into a split stance. So he's going to use his fingertips from the right, bring them up to the base of his skull, right underneath of his mastoid process, this little bony indentation right beside the right side of the head. If you go into that little recess, you'll feel a little pocket, okay? You want to be right between the transverse processes and the mastoid. And you're going to breathe out, tuck the chin down, rotate it to the opposite direction, to the left, keep the chin tucked, and then look down to the right on the opposite side. He's going to coordinate his breath, his eyes, and his body position so that he can get the muscle to relax and to elongate. So he's going to rotate, tuck his chin, look down to the opposite side, and press gently in with his fingertips at the base of the skull. These muscles are oftentimes a culprit behind ocular headaches because of their placement on top of the ocular nerve. So we want to reduce that pressure, get the muscles to relax. You can go through the breathing process for about 6 to 10 cycles and then move into the other side of the body. Between the scalenes and the reduction of the suboccipitals, this should help to restore the natural position of the cervical spine and head, and that would put us into a position where we can start to engage the muscles that are going to help to sustain this position for the long haul. Let's get into our activation. This is an isolated activation of the transverse abdominis and diaphragm using a quadruped cat-cow position. When you activate something, you're basically placing a muscle in a position where it's going to be facilitated and give you a stronger impulse than it usually does. What we're trying to target in this exercise is your transverse abdominis and your diaphragm. These are two muscles that oppose each other and help to maintain the neutral alignment of your lumbopelvic system, or the lumbar portion of your spine, and the positioning of the rib cage. It's really important as this serves as a column for your head to rest upon, and if it's not balanced, then the head is going to compensate by adjusting its positioning. So we want to teach the body how to engage the diaphragm, the muscle that actually pulls air into our lungs, while keeping the rib cage in a depressed and conditioned or position that's going to hold the diaphragm and allow it to really anchor off of the rib cage and the spine. So by being in a 4-point like Ryan is, with his knees under his hips and his palms under his shoulders, it's going to initially make his abdominals fire to support the spine, and that's going to hold the rib cage down. Now, while maintaining that abdominal pressure, he's going to breathe in through his lungs, take a nice deep breath in, and expand through the thoracic column. What that's going to be seen as is a posterior lateral expansion along the back side of the back, or the rib cage, and then he's going to breathe out, get all the air out of his lungs, and as he does that, his rib cage is going to be pulled downward and descend, contracting his abdominals. Now at the bottom of the breath, he's going to maintain the tension of his abs, and then breathe in deeply to help inflate around the rib cage and expand through the scapula. All the while, he's keeping his head in line with his rib cage, so there's no hyperextension. Go ahead and show him what it looks like. Head's not going to crank up, and he's not going to tilt his head down, hyperflexion. He's going to keep that nice neutral cervical alignment from the releases that we did of the scalenes and the suboccipitals. And by doing this, it's going to teach him how to use his diaphragm to breathe, to inflate the ribs, as opposed to using his accessory respiratory muscles, the scalenes that we just reduced. You would go through about 10 to 20 breathing cycles, breathe in deeply for 2 through the nose, out through the mouth for 4, and then we would move into our next exercise. This is an integration exercise using a prone cobra position with dumbbells to isolate the shoulder retractors and cervical flexors. You'll notice that Ryan's laying flat on the ground with his chest down. His head's going to be pointed down towards the floor with his chin tucked. And the goal for this exercise is to target the muscles that retract the shoulder blades down and back to hold the shoulder line neutral. His thoracic extensor muscle groups, the muscles that hold his spinal column neutral along his rib cage, and then also learning how to co-contract the muscles of the neck, the deep cervical flexors, keeping the neck and head in line with the rest of the spinal column. So he's going to breathe in, pull his arms back off the ground, initiate the movement by retracting the shoulder blade back around the rib cage. The arm's going to come with it, and then his whole torso would lift from the ground. He's going to breathe out and slowly come back down to the ground. You'll notice that Ryan's head again is in line with his rib cage, so it's neither extended excessively or flexed down, and that would be shown, or you would see it in your own body, as again a hypertension up here at the base of the skull. One more time, we're trying to reduce that pressure, show the body how to maintain the curvature of the thoracic portion, the rib cage portion of the spine, by getting the muscles that hold it erect or upright to be more conditioned, and he's using his abdominals to support the lumbar spine all the while as he's lifting his weight up off the ground. There's a 2-second up and 4-second down, and he's going to do 20 repetitions. The value of doing this will help to align the spine to maintain the right posture of the whole thoracolumbolpelvic hip canister, or the entire spinal column, and this should help to maintain the nice neutral alignment for the head to rest on the spinal column. So stay after it. You're going to do 2 sets, give yourself a minute of recovery in between, and then we'll go into our final exercise. This last segment is a strength exercise that's going to target the deep cervical flexors using a laying supine neck crunching position. I want to just give a warning right out of the gates that this is a pretty advanced movement and it's not for everyone. So if you need to do an alternate version, I would refer you to our last video on the sternocleidomastoid that gives you another way to do these deep cervical flexor muscles. If you feel comfortable and you want to move forward, the way to get into this position is to lay flat on the ground, supine or facing up. You're going to get into an anatomically neutral position. The legs are going to be inside the hip line with the toes pointed up. Your arms are to the sides of the body with your palms facing up and your chin is tucked. We want to recognize that the placement of the rib cage using your abdominal pressure to hold the ribs down is a natural position. It's one that we're going to want to practice. And the engagement of the abdominals with the diaphragm to breathe in is what we're trying to coordinate with the flexion of the neck. Now, oftentimes our diaphragm isn't strong enough to support our breathing needs, and so our body relies on the sternocleidomastoid and the scalenes to help get air into our lungs, making them obviously overused and creating compensations around the neck. So today we're going to teach you how to control that and hopefully isolate the deeper flexor muscles, the chole and capitis muscles along the cervical spine. So with Ryan in this neutral position, he's going to breathe in, tuck his chin, and lift his head off the ground subtly. As he does this, he's going to make sure that his head is almost pulled off of the spinal column, almost like it's being pulled up by a string, and then slowly let his head come back down to a count of 4. As he does this, one more time, he's going to make sure that he doesn't extend the neck up or tuck the chin up to the ceiling or jet his head out forward. He's going to keep it nice and tucked, almost giving himself a double chin the entire time, especially on the deceleration back to the ground. So don't just relax quickly and let it jerk back. We're going to go through about 15 repetitions, 2 seconds in, 4 seconds down. All said and done, it should be over a minute of time under tension. If you fatigue prematurely or start to notice that your body starts to overuse these superficials or the neck kicks up, make sure to stop and we can add the volume over subsequent series of training. So one more time, you're going to do about 15 repetitions, give yourself a minute to recover, and then do another set. And that would bring us to the end of our strength movement for this program. All right, so that brings us to the end of our segment on cervicogenic headaches. Remember, when the body's posture is off and the alignment of the curves of our spine are compromised, this can lead to additional pressure being exerted on the base of the skull, which then positions your head so that the nerve endings around the backside of your neck are compressed and can refer pain in or around the head, often mistaken for headaches, migraines, or pressure headaches. So by completing the activities that we showed you today, this should help to neutralize that postural distortion, bring you back to a neutral balance, and help to reduce some of the symptoms associated with this condition. If you have questions, remember, reach out to us at admin@fluidhealthandfitness.com. Remember, you can read the blog on the topic below. We also have a condensed version of today's exercises at the end of the segment. Remember, guys, your body's designed to move, so continue to stay in motion, and we'll see you next week for another edition of Design to Move.